morning and welcome to CSG University. I'm Denise Bowens and I'm here with Dr. Anthony Petrosini from the Orthopedic Institute of Central Jersey. Doctor just gave a great presentation on treatment for rotator cuff injuries. Welcome.
Thank you.
Glad to have you. You mentioned that most patients with rotator cuff injuries have rotator cuff disease as opposed to an acute injury. Can you talk about that a little?
Sure. Rotator cuff disease is similar to heart disease or osteoporosis. It's a condition that occurs with aging, and the longer we live, the more chance we have of having a rotator cuff abnormality. So if you do an MRI on patients without pain, in a younger group of patients, there's very few rotator cuff abnormalities, but as we get to older populations, we see more and more rotator cuff disease, even in patients who don't have shoulder pain. So it's similar to cardiac disease, where when you have a heart attack, most people understand that you've had some coronary disease asymptomatically for many years, and then something brought it to the forefront where it became symptomatic. Whereas rotator cuff and musculoskeletal disorders, people think of an acute injury as if the rotator cuff was perfect the day before and then it tore apart traumatically, where actually we're many times seeing the progression of just normal aging in the rotator cuff.
That's interesting. Now, what surprised me also was you talked about pain as being a poor indicator for surgical intervention.
Yeah, there recently have been some very good studies to try to correlate pain with severity of tear, and actually we're finding that it doesn't correlate well with the level of pain. So people with tears can have less pain, people without tears can have more pain. It's more correlates with comorbidities and level of education, but many times we treat people based on pain because patients come seeking a relief of pain, and if the tear doesn't correlate with the pain, maybe fixing the tear is not going to relieve their pain, and that's why some surgeries fail. So we need to have a better understanding, and it's going to have to be more research done on what are the factors that are causing the pain, because it's clearly not just the tear. The people with the larger tears don't have more pain, and the people with smaller tears less pain. There's a lot of variability.
That's interesting. What are some of the risk factors that can impede healing?
Healing in the rotator cuff is very slow to begin with. Anytime tendons do not have a very good blood supply, so anytime a tendon is healing to a bone, whether it's your Achilles tendon or your rotator cuff tendon, the healing is slow. And so things that, the reason for that is a very poor blood supply of the tendon, and conditions which limit blood supply therefore limit healing. So in an already challenged environment, diabetes and smoking are known to be two factors that really limit the vascularity of the tendon. And so multiple studies will show that those patients do worse in terms of recovery and don't heal. And that's true for rotator cuff disease, spine fusions, a lot of musculoskeletal diseases.
Great. Well, thanks very much for visiting with us, and we'll see you next time on Spotlight On.
Great, thank you.
Thank you.